everyone, I am Dr. Shradha Shejekar. I have done MBBS, MD Psychiatry. I am your Psychiatry Faculty at the Global Healthcare Academy. Today I welcome you all to the first in this, that is the Image Advantage series in Psychiatry. So without any further ado, let's begin. We have a first image for today, which is the definition of delusion. A delusion can be defined as a false, fixed, and firm belief. If you see these three F's, false, fixed, and firm belief, sometimes the firm belief can be replaced by a term unshakable belief, then you have to be sure that this is the definition of delusion. Very commonly, they will ask MCQs, which will say that a male 30-year-old has a false and firm belief that his mother has been replaced by an imposter. So here we have the term false and fixed and firm belief, which is suggestive of delusion. We will see in the further images what type of delusion this is. But as of now, what I would like to reiterate is false, fixed, and firm, unshakable belief is the definition of delusion. Next, we have Capgras syndrome. This is a type of delusional disorder in which, as I said in the previous slide, that the son feels that the mother has been replaced by an imposter. So, C in the Capgras is a mnemonic with close family member. Usually the MCQs will direct you in this way. For example, they would state that a 30-year-old male feels that the wife has been replaced by someone else. Or, as I said in the previous MCQ, that the son feels that the mother has been replaced by someone else. So in both the MCQs, the wife or the mother are a close family member. And C in Capgras and C in close, they are mnemonic for each other. Even in the image, you can see that the mother is being replaced is what the son feels. So Capgras syndrome is where the close family member is replaced by exact double. Next, we have the Cotard syndrome. Capgras and Cotard syndrome, they are very confusing terms and they almost sound similar. So I have brought a mnemonic for you. The CO in Cotard and CO in COPS. What does this mean? So in Cotard syndrome, usually there is a false, firm and fixed belief that any of the body parts of the patient are rotting. So the patient would believe that their face is rotting, just like in the image, when in reality it would not be. Many a times they ask question wherein the patient feels that his intestines are rotting. So rotting is seen in COPS, and that is why CO in COPS should remind you of Cotard syndrome. Next, we have the Beck's cognitive triad of depression. Aaron Beck gave the classical triad of depression, which speaks about worthlessness, hopelessness, and helplessness. Or in other words, the individual will have negative worth about self, about others, and about the environment. So three things: about the self, about others, and about the environment. Me, others, and the environment. Okay? Worthlessness, helplessness, hopelessness. This is the cognitive triad of depression. Catatonic rigidity. ICD-10 states catatonia as a subtype of schizophrenia. Catatonia has a classical rigidity seen, which can be elicited with the help of pillow sign. In the image, you can see that the patient has neck rigidity, and when you pull this pillow from beneath his head, the neck continues to be in the same rigid position. This is the pillow sign which is seen in catatonic rigidity or catatonia. They might also ask you the management of catatonia. We usually advise benzodiazepine, specifically lorazepam, and antipsychotics if required for the treatment of catatonia. Next, lithium usage in pregnancy can lead to which of the following teratogenic effects? facial defects, cardiac defects, urogenital defects, CNS defects. As you can see in the image, the cardiac shadow is appearing almost like a box, and box-shaped heart, also known as Epstein anomaly, is seen in lithium usage in pregnancy in the teratogenic effect on the baby. So cardiac defects are seen in the baby when the mother uses lithium. May be seen, okay, not every child, but may be seen if the mother is using lithium in pregnancy. Rejoin app. So this is the latest development. In March 2024, US FDA approved Rejoin app, which is prescription based, meaning the patient who wants to use this app should be diagnosed with a major depressive disorder and should be on an antidepressant. In such a case, the clinician who is treating this patient will prescribe using this app for therapy purpose, and the age group should be 22 years and above only. So 22 years and above, diagnosed with major depressive disorder on antidepressant, the clinician has to prescribe this app and then only they can use. Next, coming to Esketamine Nasal Spray. This is approved by US FDA in 2024 as monotherapy for treatment-resistant depression. If you all are aware, ketamine therapy is one of the latest treatment techniques used in treatment-resistant depression. It is given in the form of tablets, IV infusion, or IM. Now we have nasal spray of esketamine. It's an enantiomer, and this is approved by US FDA as a monotherapy. Means you can just give this one medication, and this is not given in every case of depression, but in treatment-resistant depression. This is the image of Sigmund Freud, a noted personality when it comes to psychiatry. His contributions have been immense to psychiatry. So he gave psychoanalysis, he gave id, ego, superego. He gave the concept of conscious, pre-conscious, unconscious. He gave the concept of defense mechanisms, Oedipus complex, Electra complex, and so on. Again, the psychosexual developmental stages. Okay, very important personality, Mr. Sigmund Freud. Thematic apperception test. These are a set of 22 black and white cards which are given one after the other to the patient who is being assessed for his personality. They are supposed to interpret what might be happening in this picture according to them. There is no definite answer for the images. It based on individual's interpretation. And at the end of all 22 cards, a score is given, and that's how the personality assessment is done. Rorschach test. This is yet another projective test for personality assessment which uses ink blots. So ink blot is nothing but a drop of ink when you put on paper and fold the paper. You see various images forming by the ink. This is the same ink blot test. There are various kind of ink blot sheets that are given to them. The images are different. What the individual has to do is he has to point out whatever he can see in the image. For example, he might be seeing a dog, or he might be seeing a bat, or he might be seeing 4 eyes. Anything. It is based on individual's interpretation, and at the end of it again scores are given and personality assessment is done. Excoriation disorder. It is a type of impulse control disorder. In this image, if you focus, you can see that there are injuries around the nail bed. almost to the stage of ulceration. So looks like a lot of impulsive nail biting is happening, and that is why this is suggestive of excoriation disorder. A patient with a history of chronic alcohol consumption presents to the hospital 3 days after abruptly stopping alcohol intake. The patient is exhibiting symptoms such as irritability, disorientation, paranoid delusions, agitation, visual hallucinations, and altered sensorium. Based on the clinical presentation, the most likely diagnosis is. Here you can see important terms like chronic alcohol consumption, abruptly stopped alcohol intake, and he has presented 3 days after stopping alcohol intake. Now he has irritability, which may be a part of withdrawal, not necessarily withdrawal, disorientation, again seen in withdrawal, paranoid delusion, seen in psychosis or withdrawal, agitation, may be due to withdrawal, visual hallucinations seen in psychosis and withdrawal, altered sensorium, nothing but delirium in other words. So, if you look at this image, you can divide it into three. So, there is a lot of changes happening here. In the first day, if you divide the first day into two halves, in the first 6 to 12 hours or the first half of the day after stopping alcohol, you might see tremors, increased heart rate, increased temperature. In the second half of the same day, you might see visual and auditory hallucination. And after the first day, before the second day, seizures are seen. And after the second day, delirium tremens is seen. So, in our question, we have 2 pointers towards delirium tremens. One is 3 days later he has come. That means he fits in here. And another is the altered sensorium. So, it is suggestive of delirium tremens. Next, a patient with a long-standing history of chronic alcohol consumption is brought to the emergency department presenting with symptoms of confusion, impaired coordination, and pain during eye movements. Clinical examination reveals involvement of the 6th cranial nerve, most likely diagnosis. Okay, so here we have history of chronic alcohol consumption, and there is confusion now, ataxia or impaired coordination, pain during eye movements. Okay, so we have this mnemonic Goa. Many people usually drink alcohol in Goa. That's why we are using this mnemonic where G stands for global confusion, O stands for ophthalmoplegia, and A for ataxia. Here there is confusion, so our G is satisfied. There is ophthalmoplegia, so O is done, and then we have this A. So the Goa is done, and the answer is Wernicke's encephalopathy. It cannot be delirium tremens because there is nothing specifically talking about recent abrupt stoppage of alcohol and other things. Corsica psychosis, not yet. It is a long-term implication, meaning if Wernicke's is not treated, then it further in the future it can turn into Korsakoff's with psychotic symptoms, obviously. And de Clerambault is a completely different syndrome, not specific to alcohol. Cannabis sativa. So this is an image which depicts the marijuana leaves or cannabis sativa leaves. This is an image of poppy plant used to prepare heroin, morphine, other types of opioids. This is an image depicting the nicotine patch. So in people who smoke or consume nicotine in any form, there are various kinds of nicotine replacement therapies. It can be in the form of tablets, patches, just like in the image, lozenges, or we also have chewing gums. In this image, we can see the nicotine patch. A 30-year-old individual presents with a persistent and overwhelming fear specifically triggered by being in or near tall buildings and elevated places. What is the appropriate term used to describe the condition? Acrophobia, acarophobia, algophobia, agoraphobia. Very, very confusing terms if you just look at them for the first time. But let me break down them for you. Have you heard of acromegaly? If yes, then you know that the individual, a patient who has acromegaly, has increased height. Okay, so acro means height. Acro means height. And here, the person is having fear of tall buildings, elevated places. So again, the question is pointing towards height. So we already got our answer here. If you want to know about the other terms, acaro, which is very close to acrophobia, is a fear of small bugs. Okay. So acaro is for small bugs. And agora, as you know, it is about the closed spaces. And algophobia is about pain. Algo. Body dysmorphic disorder. In this image, you can see that even if the person or this lady is slim, she feels she is fat. Okay, so body dysmorphic disorder is wherein the patient will have a feeling that his or her body parts are not meeting the social norms or not satisfactory enough. For example, you'll have MCQs which state that a female in her 30s visits the plastic surgeon stating that her nose is crooked, even if she has been counseled that it is fine. But she insists on undergoing a plastic surgery. Likewise, you will have any kind of patient who repeatedly checks themselves in mirror and feels that they are fat, even if they are not. So anything where there is anything suggestive of dysmorphic body image, then it is about body dysmorphic disorder. Next, we have this step ladder decline course, which is classically seen in vascular dementia. As the word suggests, vascular meaning blood vessels are involved. So the dementia in which the etiology is vascular type, there is a step ladder decline seen in the cognitive ability over time due to the multiple vascular events which keep on happening and which keep on giving rise to strokes. So the damages are happening again and again, and that's why the stepwise decline happens. And stepwise decline is the key word for vascular dementia. Next, a patient presents with an intense preoccupation with personal cleanliness, frequently washing her hands multiple times without feeling satisfied. She actively avoids leaving her home due to an overwhelming fear of contamination. These behaviors and personality traits are characteristic of which developmental phase? I have given this image to depict that this child has been undergoing potty training and there might be an emphasis on cleanliness even in this stage of childhood. So it is believed that if potty training is started early or there is strict potty training, then the individual might go on to develop preoccupation with personal cleanliness and as you can see in the MCQ, frequent washing of hands until without feeling satisfied and fear of contamination might be seen. So it is due to the anal developmental phase. This is the psychosexual phase of development given by Sigmund Freud. This is an image of transcranial magnetic stimulation machine. RTMS means repetitive transcranial magnetic stimulation. It is a type of brain stimulation technique commonly used to treat anxiety, OCD, depression these days. You have this coil which is placed on the scalp and through which the magnetic stimulation is given in the form of pulses. Next, we have the transcranial direct stimulation device, yet another type of brain stimulation device. Here, these probes are placed on the forehead, and again, the indication is anxiety, OCD, depression. Next, ONYDA XR. It's a clonidine extended release oral suspension. So this is the first liquid non-stimulant ADHD medication approved by US FDA for children 6 years and above. 6 years and above, now you can give something in the liquid form. Okay, all these days clonidine existed, but in the tablet form for ADHD. But now we have liquid form of it for 6 years and above. Next, we have this device called Modius Stress. It is US FDA approved, and individuals who are diagnosed with generalized anxiety disorder can use it at home for transdermal neurostimulation. Okay, and it is called the Modius Stress device for GAD. Our last image for today. During psychotherapy, the therapist had mixed conscious and unconscious feelings towards the patient. This is known as A. Dissociation, B. Transference, C. Countertransference, D. Preoccupation. Always remember, whatever the patient feels for the doctor or the therapist is given primary importance. So, patient has transference towards the doctor. And what the doctor or therapist has in return is called counter transference, means countering what the patient gave. So, if you find this word counter transference, you should remember therapist comes here. Okay. So, counter transference is therapist had mixed conscious and unconscious feelings towards the patient. Okay, so always the patient comes first. If patient is expressing any kind of feelings towards the doctor or therapist, it is the transference. But if the doctor is having any kind of mixed or unconscious feeling towards the patient, then it is called counter transference. So these are a few images with respect to psychiatry. It's well-known fact that visual memory is long-lasting, and I strongly believe that these images have clarified a lot of your doubts, and now they are etched in your memory, and these concepts will not be able to forget. So I hope that during your exams, you are able to recall these concepts and answer your questions well. So, all the best with your exams and come out with flying colors. Thank you.